So we're going to switch now in the medical area to your heart, which is really a good thing to keep working if you want to keep working. But how many of you guys have any clue what's going on in your heart right now? Not so many. Okay, good. So that sets up this discussion. We're fortunate here to have Karim and Nassir Marrouche, who are brothers. We have an MD and an engineer. So we have a cross-disciplinary team of the sort we're supposed to be creating. They were born that way, evidently. And Karim is, has a very good pedigree in medicine. University of California, San Francisco, probably the top research medical university in the country, Cleveland Clinic. But then Chris Johnson, who you heard earlier, helped recruit them to Utah, where they've been for a number of years. And they have this new device that I'm looking forward to getting to use, adding into my quantified self. So you want to tell us a little bit about what you got, and maybe we can even try using it.
That's a great open question. We can talk about lots, 50 years of heart disease. Thanks, Larry. It's a great honor to be sitting with you here on the same stage. It's great to have a brother as an engineer as well. That helps a lot. So, I've been researching heart disease, specifically irregular heartbeats and arrhythmias and sudden cardiac death for 24 years now. And until recently, all what we do in our profession is really we act to problems. We wait until the problem happens, and we start reacting to this with procedures, with the drug, with the catheter, with surgery, and so on. And I'm, as Chris said yesterday, I'm a procedural in training. I'm an ablationist. I put catheters and burn heart disease to cure them, so I like to see arrhythmias and treat them to help patients. But recently, the research we've been working on is how can we look at the heart before things happen, how we can prevent things from happening. And I want to start with asking the people in the crowd, as Larry asked you, how many of you here in the room, I heard we have 200 attendees around and 200 people at FiRe this year. How many of you know what the heart tissue looked like or have an ECG in the last 12 months? Raise your hand. Except the ones who have it the last 24 hours from me. Don't cheat. So that's maybe 15%, 10%. Okay. I'm starting a challenge today. If everybody in this room get an ECG strip, 15% of you, between 15 and 20, depends on the age group, will have a regular heartbeat or some issue with the ECG without knowing about it. And you never felt anything, you never knew about it ever in your life. And that's why in America today, we have 700,000 people in this country only to die every year in heart disease, 600,000 of them sudden cardiac death, right? And I think in adding to this complexity, there's 270,000 strokes from heart disease or irregular heartbeats in America alone. Is it $22 million that single disease, irregular heartbeat, will cost us in America alone? Imagine if we can detect this and understand this more and more in terms of regular monitoring. And as important, as I ask you the question, how many of you, that challenge will not stop here, we continue this as part of the FiRe concept, that's a FiRe challenge, is we want to monitor your heart, we want to understand what's happening, and if less than 15% have any problem with their hearts, I buy you cappuccinos, everybody in the room.
So we've got that down on tape here.
Number two is the reason why Chris mentioned this yesterday. We took advantage of the infrastructure of imaging and understanding and knowing our hearts. So I brought the slide with me. Can you put the slide, please, on the screen? So that's one more button. Press it one more time, please. And this is 64 hearts of patients or non-patient that I see. And
each of those is a heart.
That's a part of the heart. That's a part, one chamber of the heart called the left atrium, where arrhythmias, or the majority of the arrhythmias, or one single arrhythmia, very important, responsible for stroke, called atrial fibrillation, starts, initiates, and it's maintained. And unfortunately, around 40% of atrial fibrillation is asymptomatic. You don't feel anything, you never know about it until you get a stroke. So if you look at this slide here of the 64 different patients, if you look at the second, the lowest row, the 1, 2, 3, 4, 5, fifth row, and the fourth patient from the left side. See how much green does this patient have? Green means fibrosis or disease. Blue is healthy. That's a concept started at the University of Utah because it's an MRI scan that we run, and we give it to the image processing group, obviously with this key scientific computing institute infrastructure in terms of processing this image and giving it back to us to understand what it means. And why this is important, these people never knew that the heart is so damaged, and the risk of having arrhythmias is 10 times as high as others who doesn't have much green. So that patient that I showed it to you, she's a 52-year-old marathon runner in Utah. You never imagined that she had no other comorbidities, no other problems. And the third patient on the left, the first on the line, that's an 82-year-old man who was skiing. For 3 years, he can't ski anymore. They came to see us. They said, I know I have this arrhythmia, and people are telling me I cannot be treated because I'm too old. So this guy's heart is early stage. He can be fixed. We can do a lot of things for him versus the other lady. What I'm bringing this here is all about individualized medicine. That's the future. How can we know things before they happen, before these people come to see me? That's why I encourage everybody to monitor their heart on a regular basis. And I wish they can have an MRI every day, but MRI is allowing us to see this infrastructure early on before it's too late.
Even for me, an MRI every day is a little beyond what I'm doing. Now, every few weeks, or every month or two, that's okay. But
you know, this brings me to the next subject with Larry. Actually, Larry is one of the most, I'm not sure how many people know about Larry. I was introduced to Larry via Chris Johnson last year. So Larry sent me this email. Chris sent me this email. I said, this is my friend Larry Summers. I said, smart, you don't have to introduce me to him. I know him very well. And so detailed information, you can't imagine. I'm sorry for sharing this, but you allowed me to do so. You know everything. He have his lab data. He have his biopsy data. He have his endoscopy data. He have his heart stress data, echo data on the website for everybody to share. And his daily activities data is on the website to share, the Fitbits that everybody got in here. So, but I asked him a question yesterday. I said, do you know how your heart look like? How your heart cells look like? And he looked at me and said, no.
Missed that one.
I missed that one. And if we imagine and I got the question, asked the same question yesterday from one of you in the room, said, I train a lot and I exercise a lot. What's my chance of heart disease? I said, it's fantastic. Continue burning calories. That's crucial for saving you from heart attacks and maybe strokes. But all of us have to know that the more we train and the more we live, our chance of arrhythmias, because of these changes in your heart, are very high. And unfortunately, we'll never know about them until we go to the physician to see him or her and tell us, do this test and do an ECG. What about monitoring this in every day and understanding more as you go forward? So this is what we're trying to implement here. In this
we never could do this before. I mean, I have to say, this is really a lesson I learned from getting, for instance, a full body scan, which is like a millimeter 3D scan, CAT scan of your body by one of the people who had developed this technology. And he's done, I don't know, 50,000 people or something over the last few decades. And it does particularly public services like firefighters and policemen and people who think of themselves as in very good physical condition. But, in fact, they have all kinds of plaque in their coronary arteries. They've got all kinds of problems, and they're completely unaware of it. The thing I've learned the most, I would say, by doing all this quantification is that the idea that you can intuit the quantitative state of any organ or any system in your body is a complete fantasy. You're just hallucinating if you think that. And so you've got to measure it. And one of the problems I've had is I've actually done a lot of trying to measure my heart, but it's always a pain. You have to go, I don't know if you saw the picture of me in MIT Tech Review where I'm naked from the waist up and I've got 12 electrodes on me and I've got a VO2 mask. And I mean, that's what it's like to normally, right? So I've been waiting for somebody to come up with something that will let me do this as easy as, say, using my smartphone. You guys got anything?
Yeah, of course. So as I said before, it's always nice to have a smart engineer next to you as your brother. So ideally, as you saw, some of you saw the last 2 days, is we would like to know what the heart is doing. Unfortunately, we can do an MRI every day. But you know, the ECG, or AKG, as everybody knows it, which is funny. It says HEG, but ECG is written. It's something that we do a couple times a year, or maybe if you're lucky, every other year. We came with this idea is, why we don't monitor the ECG every day with the smartphone? You heard about it today in multiple people, how far we are far away from giving the power to consumer, empowering the patient to know what is in heart, what his heart is doing, how it's behaving. So that's an idea came to our mind to understand the patients and then get connected to us more quickly and 24 hours a day. Please don't quote me. I said that they will kick me out of my society if I say 24-hour day connected to your physician. But this is the reality, and this is a fact we're trying to pursue here. Monitoring your heart every day and monitoring your patient if you get to be a patient 24 hours a day. And that's why I talked to Karim, and we came to this idea, and then he implemented this in place, and hopefully he can show us first what he can do and then we discuss what the results look like after that.
I get to be the guinea pig as always, right? I love doing this stuff. Okay.
Just a second, please.
Take your time. What I love about this is the way that NASA does stuff. You know, the pictures come down from the Mars rover.
That's my iPhone, by the way.
And they go to the grade school kids at the same time the scientists are seeing them for the first time. So you're getting to see this.
So Larry shouldn't be talking now because
Yes,
you have an
okay.
ECG done. So what you're seeing here is obviously Larry's ECG. The reason why it's slower because the TV, but it's a real-time ECG. And you can tell, we can read a lot from ECG. First of all, I can tell you his heart rate is slow, which is fantastic because he trains a lot. I can tell you his QRS, which is the spike you see. That is the activation of our heart muscle, right? It's narrow, which is great because it tells me a lot about activation. The muscle of the heart, is it pumping well? Is it pumping fast, which is a good indicator? And last but not least, I can tell with these spikes you see, recovery of the heart, okay, the recovery of the heart tissue. So that's an iPhone device. He have it with him 24 hours. I hope he get one of those today, and he can use it 24 hours a day. And he sent me one of those. And as important as you see here, this is important. We talked about this today, just before this meeting, verticalization of data. You can analyze your data instantly. He got an analysis. Sinus rhythm means the normal heart rate, okay, average heart rate. And imagine Larry is sending me one of those every day. Instead of he's sending this to Chris Johnson, all this data, which is important, the CRP data and so on. If we get the scale of this, if we get the graph of how is the QRS changing when he exercises, when he is in stress situation like now versus he's on the beach, where we can scale this and go on different levels of analysis and understand all together through you, not through us as physicians, what does this mean when he's in danger, when his heart changing. We can't predict before it's too far, and maybe we can manage his heart and send his heart.
But the other thing I love about it is, look here. I mean, just look at these folks. So I had 55. I'm up here on stage. I'm really tense. I'm really under a lot of pressure. My heart rate's 55. What about all these other people? 80, 71, 109, 115, 89, 77. So one of the things you want to know in any of these measurements is how do you relate to other people?
Yeah.
And so the idea is not just that you're getting your heart read out. And I love this idea of being able to do this all the time, because when I'm on my elliptical and I've got my heart up at, say, 140, starting from, say, when I sleep, it's about 40, and my resting heart rate's about 45. So, I've gone up, 3 or 4 times my resting or sleeping heart rate. That's putting some stress on my heart. I'd like to know at that moment, how is my heart doing? Not just when I'm sitting here at 55. Not so hard. But then to be able to do this not only gives my own standard, that is, how do I change over time under different circumstances? But then how does that compare with a crowdsourced set of folks, none of whom know me, but who are giving data that I can compare to? This is just as good as it gets.
That's exactly That's exactly what we are planning to do. So let me tell you a little bit about cardiac designs. So cardiac designs is a, oh, I don't want to show you my, my iPhone. So, cardiac designs is an innovative heart monitoring company that focuses on wireless technology. As you can see, we provide a very simple and yet affordable solution that monitors your heart on a daily basis. And that's what we basically want to achieve on a continuous basis going down the road. Another very important point with the healthcare reform that's soon coming, we believe traditional monitoring is not a sustainable model anymore, and it's going to be replaced by smart wireless monitoring, this is a part of it in 5 to 10 years' time. This will not only dictate our lives, but lengthen them, as Nassir was predicting before. And I would like to add one more thing, is I want to give a special thanks to Sharon and Mark for giving us the opportunity to present this new technology to the whole world, because as Lihud said 2 days ago, personalizing and digitalizing healthcare starts with education, and we believe that education starts here at FiRe.
So tell me, when can I get this?
You can get this on Monday on our website, ecgcheck.com.
So what is really radical about this, and of course there are other companies that are beginning to go into the cardio space. It's not the only company, but and each of them will have pluses and minuses. But I have one of the top cardio doctors, Dr. DeMaria at UC San Diego in the country, who I've seen once in the last year, and then I do a test at that moment in time. But what I'd like to ask you guys is, if I had atrial fibrillation, or I had some of these other things that you can detect from looking at anomalies in the time series, how likely is it out of 365 days, and if you figure it out, there's 8,000 hours in a year, so it's 1 out of 8,000 hours in a year that you're on the stress test and you've got the ECG hooked up to you. Are you likely to pick up an anomaly as opposed to doing this, say, once a day?
That's an excellent question. That is what the continuous monitoring, we're calling this a continuous monitoring, practically all your life. Very important here to know that in AFib, or atrial fibrillation, as we call it, AFib, or PVC in extra beat episode, they become dangerous and problematic for us when they are longer than 4 to 6 hours a day. And we're having a device like this. I mean, when you're having your coffee and your lunch and your dinner, you just have a 10 seconds recording. This device will tell you you're okay or not. If you're not, then you can call us. While the monitoring device, you're monitoring one, imagine, like, let's say you have a Holter monitor or some kind of continuous monitoring for a month even. So you have every day 65,000 beats of your heart. Your heart is very healthy in terms of slow. That's another discussion. We can talk about how slow your heart should be and how fast it should be. That's a different discussion, completely different discussion. But you probably have 60 or 55,000 beats a day, and imagine you have 300 of those. 10 beats could be an indicator for a problem, right, in this. And then you have it only one time in your month. You got this test recently.
Right.
But what about the rest of the days? Your heart is not working, it is working. This is the problem with this arrhythmia, and this is why. This is number one reason why in this country alone you have so much patients with strokes because of AFib, because they never knew that this is a disease. For example, if you have this with you, an example that happened in the last 3 days, I have 3 examples I want to share with you. Number one, a patient of mine who lives in Dallas called me at 6 o'clock in the morning, and I happened to give him one of those as a prototype. And he said, Nassir, I'm not feeling well. I want to go to the ER. I said, send me a strip. He sent me a strip. His heart was fast. I said, take that pill. Call me in 15 minutes. He took a pill that protects him from stroke, a blood thinner, and he took a pill to slow his heart rate down. Called me in 15 minutes, felt better. I just saved the system, or the ER visit, which is $5,500. Okay? And imagine if we can save 48% of the ER visit for cardiac disease in America because of immediate response from physician or centers. This is a multi-billion-dollar industry that we have to be aware of. And all it takes us physicians to be proactive. It starts with you. We start with people like you to start being proactive. So I want my heart to be checked. Example number 2, one of my best friends in Germany. Last week I have one of those as well. His dad, we were sitting with dad, he said, Nassir, my dad's not feeling well. He's really pale. And I think I think his heart, I'm testing his heart. His heart is very slow. I said, get one of those. Get an ECG. He got an ECG. And I said, don't take him to the ER, just take him to the cath lab. We have an ST elevation, and his heart was 25 beats a minute. Usually we get to ER, wait in line until he can.
You'll be dead before they get to you.
And these is two simple examples that we're using now. And we're saving drugs, for example, with this. There's a series of patients doesn't want to take drugs all the time. The ones of you, I bet you, there's at least 2 or 3 of you in this room who knows what, non-physician, who knows what blood thinners mean for avoiding stroke and so on. Imagine if you have to take the blood thinner all your life versus PRN when needed. So you check your heart rate, or ECG, I don't use the word heart rate, EKG, 3 times or 4 times a day. And if you see an arrhythmia, you take a pill and you call your physician instead of taking it every day and have a higher risk of bleeding. That's another saving. We don't talk about saving yet. I'm talking about improving quality of life and outcomes. But imagine how much we can save. It's a simple device as this one that connected to your ECG.
As we go forward, so this is Monday. What's like 6 months from now or a year from now? As you sort of look out into the future of this, I mean, this is wonderful, but like, what have you done for me lately? What are we going to see in a year?
So what we're planning to do, and we actually started doing this, it's in the prototype phase, is basically looking at changes in detailed points of the heart rhythm. For example, Nassir can talk about this a little bit more detailed, but for example, QRS, which is a very important implication of heart diseases and strokes. So how is the QRS basically changing over a period of time? And we are able to basically track that QRS. Every time you do a recording, you get a pin of QRS. And that, if you calculate that over a period of 1 year, for example, you would track how is your QRS widening or lengthening for that period of time. And that...
So you mean when I just did this, you've got the data actually saved, and you can compare it.
Mm-hmm.
When I do, software can compare it, basically.
Exactly.
Every day.
Yeah, I love that. Okay.
And the other thing is, because we're at FiRe, and you heard this great announcement yesterday from the collaborate.org. We just, today in the morning, we sat with Kevin and his team, and we started the first project. It's called the heartogram.collaborate.org. And starting today, when you be part of this, you can download your data. We're going to customize it for you with Kevin and his team and Karim. And I like this level idea. We have a million levels. So now I can tell you probably is a guy in San Diego enjoying the beach versus a guy living in the mountains of Utah like birds versus a guy in Germany. Imagine how much information, real-time information predicting heart disease and changes with time. And I talked to Tony in the back, so imagine we can this subgroup of people and get genetic data on them, how much this will help us. So that's networking, community. Let's get communities in place, and we started today. And hopefully we can understand, changes in ECG based on multifactorial, diet and calories and Fitbits and so on.
Any questions? Go ahead and go to the microphones. There we go.
Hi there. Congratulations on your product release. That's someone who works out a lot and takes very good care of my nutrition, as Larry knows. My mother had a heart attack before she was 40. My grandfather died when he was 50. So I feel like one of those people with a funky heart, and I just don't know it yet. My question is, Larry, I've heard you say your doctor's worst nightmare when you walk in because you have all of this data that kind of goes against his intuition. So I wonder how we're doing establishing a medical community or a network within the community who's willing to change their business model and how they practice medicine and practice by looking at data virtually and making decisions in the way that you described with your example patient.
Well, let me just turn that around and say I am a selection filter for doctors. So we just had Kevin Patrick up here. We've got another MD. Here, these are two MDs you've seen in 2 hours that are totally with the program. So it's happening out there. It's just, there's all, I mean, anything we've talked about at FiRe for the last several years about digital revolution, right? Most of the companies are in the late adopter phase, but there's some that get it, and then they're the ones that become the new leaders. Same with doctors.
Hi, I'm Melissa Milburn, and my question is really simple. Not all of us have iPhones, me being one. I have a Windows mobile phone. When will we be able to get this on, say, an Android or Windows mobile platform?
Have you heard that before? I'm only Android.
Thanks, Melissa. Technically, we are ready for Androids and also Windows Mobile. Even our FDA clearance allows us to sell on different platforms. The issue is we're waiting for the Androids, for example, like Samsung, to officially release that they support Bluetooth Low Energy. So it's a Bluetooth 4.0. Once they release it, then you can even use the same case, exactly the same case that we have right now on an iPhone. At the moment you can use it on the iPhone, on the iPad, on an iPod 5th generation, and once Android releases that statement, then you can use that exact same one on that Android as well.
Gentlemen, Robert Hadley, great product, wonderful talk, thank you. I have two questions that are really flip sides of the same issue. So as you track this EKG data coming in, do you get outcomes from people? So can you analyze the data in quantity in your cloud and figure out maybe there's some new measurement or reading that you can get to determine outcome, number one. And number two, how do the early adopters that are sending you this data protect themselves from being harmed from that by insurance purposes, for insurance purposes?
Let me start with the first one. Yes, Karim tried to explain this based on the example from Larry, the QRS, the changes. So we know, for example, in medicine that the beginning of this spike to the end of the spike or the end of the second pump, which is called T wave, we know that could predict sudden cardiac death, changes in the heart or heart attacks, and prolongation, widening could predict heart attack ongoing or some structural disease or heart failure and so on. We know that. So that's a curve, that's a predictive value putting together in every ECG. So every patient is his own control, right? So every day we're controlling to get out with this. And so that's happening, that's part of our deal, yes, we're doing this. And now with this crowdsourcing or data funding, whatever you call it, from the collaborate.org collaboration, we can get more information, understanding people with slow heart rate. Are they at this training that much to bring their heart rate to 45? Is this important, or is it higher danger of arrhythmia? Maybe it's saving them from something, but it's about something else. Nobody knows these questions until we start tracking them on a daily basis. So your second question was, how do people, at first adopters? You want to answer this?
So
Just very quick, because we're essentially out of time.
Okay, so first of all, the data is encrypted. So is encrypted and is HIPAA compliant. So nobody will have access to the data if the user doesn't want to. That's basically the answer for this.
So he doesn't have to share it with the physician.
Fast question, how much is it going to cost?
It's $99.
So,
Wow. Okay.
Thank you.